So the setup is going to be the same in regards to the height of the table, as well as the patient positioning. So our pre-manipulative checks are going to be knee flexed. You're going to come over to the side, and then I'm also going to be come down a little bit lower. Yep, because we don't want to have that rattle. This is going to be an energy leak for our thrust. So again, when we get to the lower thoracic spine, there's dialogue and discussion about different handholds. The one that was taught in the courses that I've taken has been more of like your cup position. I stick to what I use for the upper thoracic with just using a little bit of material in between my PIP and my DIPs. The difference in this case is usually you need to flex down to the level in question, and so there's like this kind of similar to what we saw earlier when Tiff had I think you had flexed, right? Right.
Oh,
is like extension? You come. Oh no, we just did extension where we like pull them down and they go and their elbows go up. That would be more of extension. In this case, we're going to have a more flex position. Again, our goals are to try and create a shearing effect of the top segment on the bottom. And so we're blocking this bottom segment as we create a shearing effect like that. So this typically is anything from like T4 or and down. So, based off how much mobility and the size of the torso that the individual has will dictate like how much material you need in between. So I'm gonna bring that up, and again, it's the same concept where you kind of have the far arm on top, and see different than our last patient, right, where you can actually see that her elbows get even past one another. So that's kind of an indication either can we create enough tension here, or do we need more material? I think we need a little bit more material. Sorry, Joy, I'm going to come up a little bit higher. Actually, go ahead and release, and let's do this. I'm debating whether we need a pillowcase versus a towel. I think we're going to go pillowcase. Just a little bit of something extra. All right, here we go. Scooch towards me. Yep, there you go. Right, so we're gonna go right around the brow line. Same concept where I'm gonna pull down as I rotate her over. Not quite underneath her, and notice how she's just letting me kind of move her. So Joy, what I'm going to have you do is use this bottom leg, or your right leg, to help to leverage your pelvis over as well.
Right.
Thanks for that. Yep, and that's a ton better. I can really get underneath her, so it'd be like this. Great. I'm going to step up to the head of the table. Yeah. So good stuff is to get the hair out of there. So, Joy, I'm going to lift your head, because, yep, there you go, because otherwise I just pull your hair when I thrust it. So I come over top like a mohawk, big breath in, big breath out.